Good morning, everyone, and welcome to today's special Movember session and initiative by Voice of Healthcare on men's health in the workplace, fostering wellness, awareness, and support. I'm your host, Subhangi Das, and I'm delighted to be guiding this important conversation. Men's health, especially in the workplace, is often pushed to the sidelines. Silent stress, unspoken burnt out, skipped checkups, and societal expectations all play a major role in why men often overlook their well being. Today, we are here to challenge that narrative and open up a much needed conversation around awareness and support system at workplaces. We have with us Mr. A.V. Balaji Babu, who is the HR Group Head and Vice President at Yashoda Hospitals, Hyderabad, to share his views on men's workplace wellness. With over 3 decades of HR leadership experience across major Indian and multinational organizations, he has been at the forefront of transforming people's practices and promoting high quality employee well being. Thank you so much, sir, for joining us today.
Thank you. Thank you very much. Thanks for the
It is
invitation.
a big privilege for us to have you. Okay, so Movember, when we talk about it, it's all about men's health. But often it is a conversation men don't have, or simply sometimes they don't even want to have such a conversation, maybe because of stigma, or there could be a lot of reasons. So, sir, from your expert perspective, why is it so important for organizations to start this timely conversation now?
Uh, Mental health is one of the important thing, but often men won't give the importance. Definitely, it's carried out stigma. In healthcare, where we are the caregivers and well-being still carries even deeper. Organization can change this by creating an environment, but in really, whether men is feel safe, seen, or supported. I feel how we can support this initiative is by having leaders talking openly about well-being and vulnerability, by building peer group and support circles where conversations can feel nurtured, natural, and it should not be forced. I also feel we need to ensure confidential access of counseling without judgment of the person because moment we talk conversation, it feels whether it is confidential or not, then people will not be open. And also, we need to train the managers, I feel, to recognize how we can reduce the stress in the hormone service environment by also normalizing well-being discussions in every forums and also awareness sessions as and when we are having the open conversation informally. As also, I feel organization should have an openness in sigma fits situation where men feel they can talk freely. We can protect well-beings for not just individual but the entire healing community around them, I feel.
That was really insightful, sir. That really makes us think about that maybe at corporates, there still remains a barrier between the leaders and the employees who work under, the leaders team. So that was really insightful. Moving ahead, I would like to ask you, men's health, particularly mental and emotional well being, often carries social stigma, as you said. In your experience, how can organizations, especially in healthcare, create an environment where men feel comfortable discussing their health concerns more openly?
Mm, I feel we need to have in our current situation, we need to have early awareness to save the lives. Men's usually will have statistically less likely to seek medical help early. By normalizing discussions on health, companies also will encourage preventive health checks and also early deductions and also hypertensions like diabetes and other things will happen. And also, we need to create a workplace culture to improve where men feel they are safe when they are talking about it. Have the open conversation, like I mentioned just some time back, on wellness for trust. Belongingness and psychological safety is one of the important thing I feel. It is a key ingredients to have a healthy workplace, but
So,
also encourage people. People grow up internalizing the idea of they can stay strong, not show vulnerability. Overall, organization initiatives challenging these norms to help the create compassionate and also environment, which will also become more and more open on the culture and also treated a conversations.
So that's really gonna influence a lot of people in their interpretation of men's wellness and creating a comfortable space at workplaces. So there remains a lot of workplaces where men's mental health is given little to no priority. And as you said, it's all about creating a safe environment where people feel comfortable to talk about their emotions, work stress, and feelings like that. Do you think? Like there are workplaces where still mental health is something that is given no priority at all.
Yes, while many organizations are open up, but unfortunately, there are still reality in many workplaces across sector. There is no one particular sector. Across sector, even now, that pride of themselves of care and compassion is very less. One, maybe the stigma still runs deeper, where they're expected to top it off, suppress stress, and also avoid expressing emotional strain. While the culture where burnout, anxiety, overload are normalized rather than being addressed. If you can see where high pressure industries like healthcare, whether it is IT, finance, aviation sector, hospitality sector, and to a little extent manufacturing also, often push performance above well-being. The current scenario where the environment focus on output rather than on speed and availability with little room for vulnerability and conversation about the mental health, because the cost is always high. When men's mental health is ignored, team becomes less collaborative, absenteeism rises, the decision making and quality declines. And also it burnout spreads to overall culture becomes little unhealthy. According to me, many workplaces should now recognizing uh, by ignoring mental health is not just a personal issue, but it's a cultural and organizational risk. It is happy to say many organizations have come forward to recognize on the workplaces that encourage openness, emotional safety, and inclusive conversation tend to become more resilient. And it will also become humane. And definitely, with all these things, organization will become high performing on the whole.
So thank you so much, sir. Now, so men is not allowed to look vulnerable as per the society. They are labeled as the caregivers, the providers, the forefront of a family's economy. So often they tend to choose career growth ambition over personal health. How can leaders balance encouraging ambition while promoting habits that prevent burnout and chronic health issues?
Uh, yes, I agree. People will not give the importance, but at the same time, by seeing the situation, people tend to go for career rather than the health. While career is important for us, but I feel now and then one should always recognize if health is there, then only their other things will come in the picture. One, what I feel is rather than it's a newer, what do you say, newer ambition or whatever it is, we need to have a model health ambition. Employees need to pay more attention what leaders do than what they say, and celebrate outcomes, not just the work. Employees, all the men, we need to celebrate the outcome, not the work, because we will work hard, but the outcome may not that much great. But if we are continuously do the outcomes rather than the just results, and promote micro habits, not just the speeches. We may talk many things about pressures, pulls, and all these things, but how are we managing our workload? What support do we need? We need to open up and ask our support system or the managers or the colleagues. And also movement of work, hydration, regular checkups. Will all these things will help men to manage both workload and also their health.
Thank you, sir. I strongly believe a lot of people will learn from your expertise and words of wisdom, and a lot of employees who are working or going through a similar situation would be much more able to talk about it to their managers or seek health support. Sir, what are the most common physical and mental health challenges that male employees face in today's fast paced work environments?
While many things are coming in the picture because of the situations, but according to me, some of the common physical health things will come is health risks, majorly hypertension, cholesterol, and stress-driven cardiac issues. One more thing, where we work in the offices, we get back and neck pains because we long time sitting hours and poor ergonomics where we have the ergonomics, and which also leads to obesity and metabolic disorders, which leads to diabetes, fatty liver, and lifestyle related concern. I also see I myself, if I have more stress, will have sleep disturbances for irregular hours, screen exposure, not just work on the laptops and other thing, and also on the mobiles, and which also leads to like change in the lifestyle habits, where people who have smoking and alcohol, where tend to become more usage of that, and which all lead to skipping the preventive health checks. Where they want to do it, the procrastination will happen because everyone feels today, let it go because of the pressure. Let me complete it, then we will go for health checkup. We will not give that much importance.
uh, that really spreads a lot of light on not only the mental health concerns and the physical health concerns and the potential consequences of ignoring them. So it also breaks a lot of stigma actually. People think that, okay, if I'm not giving much importance to my health, then and I'm just putting a lot of attention on career growth and ambition, I'm just going to be fine. But people are often, especially men, are not aware that how dangerous it could be for them. Sir, I would like to know, in most organizations, maternity leaves and women's health benefits are well structured, whereas men's health and paternity leaves often receive less attention. Why do you think this kind of a contrast exists?
Mm, yes, in most organization, maternity leave and women health checkups are well structured, where men health and paternity leave often receive less attention because one, maybe because of the industries, is already maternity is already covered in the maternity benefit act because of the supporting women from the legal standpoint wherever it is there. But however, now organizations have realized, along with maternity, we also need to take care of the other genders, where the health benefits has to be well structured, and men's health is being there. Nowadays we are coming across various organizations coming and extending paternity leave for more and more people, so that people can spend time with the family and also have uh, love and happiness among the newborn kids. And on the whole, why this exists? Because historical norms, and also it, according to me, it is because of biological versus cultural expectation. Maternity leave is essential for physical recovery for the people and other thing. That's where it is there. It is an optional rather than other side. And also, like we talked about it, stereotypes about the men. Men often expected to prioritize work, avoid vulnerability, and fewer breaks, which reduces awareness and demand for the health benefits. And also, lack of role modeling. If you see, few female male leaders historically took paternity leave or openly talked about men's health, so policies don't resolve strongly. The shift is happening. What I am seeing it, modern organization is realizing that men's well-being and meaningfully paternity leave are critical for healthier families, more engaged employees, and also balanced workplaces. Supporting both men and women equally is not just good for HR, it's a good leadership and also for the whole organization.
That really proves a point that a healthy home or a workplace is not just made up of healthy and well women, but men as well. Like it's a team. In order to flourish as a team, mental well being and physical well being of both the genders are equally important. And that brings us to the last question of this round. Looking ahead, what innovative or emerging approaches do you envision HR and healthcare institutions adopting to support men's health in a better way, considering both physical and mental well being?
As workplaces is evolving, HR and healthcare institutions, if I talk more particular, are beginning to recognize that supporting men's health requires more than traditional welfare initiatives. The future will be shaped with the innovative ways and also personalized and sigma-free approaches that addresses both physical and well-being. What is emerging, according to me, is personalized preventive cares through wearables, digital healthcare dashboards, AI based risk assessments. And also, it is coming up more and more confidentiality in keeping mental health access, whether it is a telecounseling, an anonymous chat therapy, and also digital well-being platforms. Leadership training is also coming up, where it is talking about psychological safety, which enable managers to spot burnout early and help the team members. Strong paternity and fatherhood support, where included extending leave and coaching of the people, whatever it is there, it's happening. Holistic wellness modeling is also coming up for giving fitness, sleep, mindfulness, and nutrition. One thing where I missed out to talk about is, along with all these things, nutrition is one of the most important thing where organizations is coming forward and do it. On the whole, policies shifting towards equity, often balanced health benefits, flexible schedules for men. I'm sure looking ahead, men's health will move from being a silent concern to a strategic priority, creating workplaces where men are supported, empowered, and healthy in every sense.
Okay, thank you, sir. That was really enlightening. We'll now move on to our next round, which is the rapid fire round. I'll be asking you a series of quick questions, and I'd expect you to answer them briefly. So, my first question would be one habit every man should adopt for better health at workplaces.
I feel take a 5 minute break for every 1 hour.
Okay, so I bet a lot of men will take down notes now because men I have seen like we all have seen that men tend to think that okay, I'm gonna finish deadlines because I'm a provider, but it's important to take breaks. And the next question would be quick tip to manage stress during a busy work day.
Take a 2 minute break on and off, depends on your own situation, because that helps to go from a long stress to taking a break.
So, what is your favorite way to stay active while at the office? And in a way, you are taking care of yourself, not like desk work or something that keeps you happy at workplace.
Standard move do here and there with your colleagues or with your team members. It will make you active, and it will also move out from your regular things. Also, what I generally practice whenever I have calls, wherever possible, stand or move in during the calls within the allowable limits, so that you'll be active.
Wonderful, sir. So, what is the biggest misconception men have about their own health at work?
I think this is an interesting one. Always we feel I'm fine as long as I'm feeling okay.
Thanks for clearing out that, sir. Best way for organizations to encourage men to talk about their mental health.
I think we touched upon
Yeah.
previously. We need to have creating a culture of psychological safety, wherein vulnerability is normalized, not stigma wanted.
Okay, I think we have went into deeper onto this topic, but what is that one workplace change if you could make in all the organizations that can significantly improve men's well-being?
I think giving men the autonomy to manage the time, where whether it is for exercise, health appointments, or family responsibility, to makes it overall stress management and preventing the burnouts.
I'm sure a lot of organizations and policymakers will get influenced by this. So, the last question is, if there's one message you could send to every man right now working in different workplaces about their health, something that could truly change their life, what would it be? That one advice.
Your health is most important asset. You don't wait it to compromise to care for it. Have a prioritize regular checkups more than anything. I strongly believe and also practices have a walks every day, at least 15 minutes to 30 minutes. 30 minutes most of the doctors say, but at least 15 minutes, even though whatever time you have, you take care of your mental and emotion well-being. It makes a small habit change. It becomes strong. Work starts at being strong for yourself. I strongly practice this in every day of my life.
That's wonderful, sir. A very big thank you to Mr. A.V. Balaji Babu for sharing his valuable insights and practical advice on fostering men's health in the workplaces. To our audience, let's continue to prioritize wellness, break stigmas, and support one another. Because healthy workplaces can only flourish with healthy men. Thank you so much, sir, for your kind words and big words of wisdom. I'm sure this influenced a lot of people.
Thank you, Shubhangi. Very good interacting with you and also sharing my perspectives.
Thank you. Thank you to all of our audiences for joining. This is Shubhangi Das, host for this conversation. Thank you.
Thank you.